Hello there, and welcome to another episode of Facebook Live. And we're super excited that you were able to meet with us today. Isn't it amazing that we're coming from the great, Flint Hills of Western Kansas? It's so fun. I'm just sitting in front of the picture. Okay, but that being said, today we are talking about the vagina. So number one on my list is to talk about a supplement. Now, I bet you have never thought about putting a probiotic tablet in your vagina. Well, today you're going to think about it. So what happens is you can use the probiotics we have, and you can use a lot of the other probiotics as well, because your vagina is just a environment that needs good bacteria, and it's self-cleansing. What other area of our body is self-cleansing? I mean, the vagina is so cool. So that being said, if you put a probiotic up in your vagina, oftentimes it can help it be healthier. And I just bet you weren't thinking about that today. So I'm just throwing out that as a thought. Because, a lot of times we'll think I eat yogurt, or I took this probiotic orally to help, but there's nothing like giving right where it needs to go. So just know that you can always, the probiotics we use are from orthomolecular, and so those are the particular probiotics I'm talking about. I can't speak to a lot of the other ingredients of others, but I know this one works well and that we have used it in this regard before. So I bet you won't think about your probiotic the same after that. Okay, now the next thing I wanted to talk about is first of all, we're going to go everything vagina. And if I get too lengthy, I know Lauren will rein me in, because I can get excited. I've spent decades of my life in the vagina. And so that being said, I realize that I get to help both women and men for so many different things, but there definitely seems to be a connotation for women, I believe, when we talk about our genitalia, that we might get a little embarrassed, or we don't even want to think about it, or we don't want to talk about it. The other thing too that I've realized is that there are a lot of women that have never had an orgasm before, and they've just been afraid to talk about it. And one particular patient, for example, she was in her 50s, and we did a specific procedure, and she was starting to be able to have them, and she just looked so enlightened. And so in my heart, I thought, how many more people feel this way? Because I also feel like when I grew up, talking about our vagina is dirty or it's bad, but it's not. It's part of our body. Having sex with our significant others, or whoever it is an opportunity to connect with that person. And connection in the world is a beautiful thing. It's not anything to feel bad about. And talking about it doesn't make us bad people. It makes us human. So I just wanted to say that if you haven't had an orgasm in your life, hey, explore it, right? There's things that you can do. It doesn't mean there's anything wrong with you. There are just things that we could do to maybe make that part of your life even more juicy and fun. And so having an orgasm is a way that your whole body just kind of relaxes. It's a way to get rid of stress as well. And so I also feel like for a lot of women, our love language is not as much physical touch and the means of penetrating intercourse. It can be a lot of other ways, and not to say every male's love language is physical touch or penetrating intercourse, but I feel like there is a lot more significantly more men that feel like if they are able to have a sexual relationship, it makes them feel better about themselves and more connected with themselves. Whereas with women, our minds are all over the place. And so maybe connecting in that is part of it, but there are so many more parts to what we're thinking about. And so maybe part of our minds working that way is where men seem to talk about sex a lot of times differently than women talk about sex. So, but no matter how we're talking about it, we should feel comfortable being open and honest about it, because again, it's a place to connect, and with connection with each other, a lot of times we find peace, and we find peace and release of stress. The world's just a better place. So let's talk about anatomy too. Okay, so when you talk about anatomy, the clitoris, and I'm just going to start from the beginning and work through, because I think a lot of times we don't even know these things. So the clitoris is just right up underneath the tip, and it's this really potent, little, tiny, amazing bundle of nerve fibers that makes us be super sensitive. And then you have your labia on both sides. Now you have your labia majora, which is the hair-bearing surface, and then you have the labia minora, which is the non-hair-bearing surface. Now, also I want to make a little comment about the labia. So I've been looking at the labia my whole life. And that being said, I'll hear a lot of times when people come in, is this normal? And what the heck is normal? I don't know. And so there's variants of all different types. Like some labia are a little bit bigger, some labia are a little bit smaller. And I feel like the fact that we have a lot of shows about body changes, that people are much more aware of what some cosmetic labia may appear like. And so within that, we may be misled that there's something about us that's different. Plus, the other thing that happens is when you have a baby come out of your vagina, it just kind of changes a little bit. And I'm not saying it's not yours, because it still is yours. But sometimes what happens is with that change of anatomy, it may feel a little bit different when you have intercourse or things like that. And I just also want people to know, you don't have to do anything about that, but there are things you can do about it if it bothers you. Because if we're going to, now we've talked about the labia majora and minora, let's just talk about the vaginal opening itself. So if you split those pieces of skin apart and you look at the vagina, if you will, or the perineum, let's call it, the perineum is all of that area down there. What you're going to see is your urethra, where you urinate, is up top, the vagina is right down below, and then your rectum is right here. Now there's this little area right between the vagina and your rectum where there's this like posterior fourchette, or kind of like body of tissue there. And so when we start having babies, there's certainly with more injury that happens with childbirth, sometimes that area between the vagina and the rectum gets a little shorter, a little bit more open. So and then also think of the vagina as a tube. Okay, you have the opening, which is the outside. It goes all the way into the cervix and up to the uterus up here. So when you think about the vagina, the outer 1/3 of the vagina is all, as a female, that I feel. I do not feel anything up deep inside, because the upper 2/3 of my vagina have no nerve fibers. And that is why I can lose a tampon and not know it's up there. When I've taken out my own share of retained tampons for wonderful patients, and it does smell bad for them, and they're horrified, but I just always tell them, oh, your vagina's upper 2/3 have no nerve fibers, and it's so easy to lose one. Now, I think a lot of people think with intercourse and with sex that we feel how big a person is or how long a person is, but when you really think about it, we only have the end 1/3 of our vagina that we can feel. So it's really there that all the sensation happens. But a lot of our drive for an orgasm can come potentially a little bit from the G-spot and also from the clitoris. So you have to think about positions and things like that as well, because I'll have patients come in and they'll talk about, well, my partner really likes doing it this way, but it really doesn't do too much for me. And I'll explain to them their anatomy and where their neurological connections are. So your clitoris is up front. So if you're having intercourse and you're on the bottom and your partner's on top, then your clitoris is hitting your partner, which can stimulate you. But if that's not your position and your clitoris is not being stimulated, then sometimes it just doesn't feel the same. And that doesn't mean there's anything wrong with you. That just means you are like anatomically super correct. So I just like to point that out too, that definitely changing up that position, and as much as you can stimulate those parts of your body, that feels really good. And that can also help increase experience. So what things could I do if I am a female and I'm like, dude, I am just having the hardest time having an orgasm and I don't understand why? Well, sometimes it could be medication related, because some of the medications we take to help with our emotional sense of well-being can reduce our ability to achieve orgasm, and that's super normal. So be sure to have that open dialogue with your provider about that. The other thing we can do is that, we can do an exam, make sure there's no pain, make sure there's nothing that looks different. But the first thing I always like to start at is the clitoris. And if someone says, I'm just not feeling it there, then one option of something that we can do is something called Scream Cream. And Scream Cream, to me, sounds like it has this most amazing name, and that everyone's going to have a rockin' awesome orgasm on it. And some people may, but a lot of people may not. But it does make your clitoris a little bit more sensitive. So you can imagine that if my clitoris is a little bit more sensitive and it's hitting against my partner a little bit more, maybe our brain starts thinking down there a little bit more. And the other thing I'll tell patients, because a lot of times they'll think, I'll just take Scream Cream beforehand. Well, that's a problem for me, because I don't want to be thinking about, if I want to do it, I don't want to do it because I'm trying to talk myself into it. So I usually encourage all of our patients to use Scream Cream every day, because maybe you're driving down the road and get like a fun thought. Well, I'm super excited for you, because so many times we don't have fun thoughts, and it's fun just to have those spontaneously. So you can use it every day. The other thing we'll do is we'll use our shockwave machine, and it's not shocks, it's actually sound waves. And what I'll do is I'll use it on the clitoris, the labia majora, the pudendals, which are the nerves that come out and feed that area, and I'll also put it in the vagina, arc it up behind the pubic bone where that G-spot is, and just help with neurological regeneration as well as vascular regeneration. Because if I can feel a little bit more in a pleasurable place and I get a little bit more engorged with increased blood flow, I'm a happy girl. So those are a couple of different things you can do about the clitoris. The third thing sometimes I'll talk about is oxytocin. So when I bring up oxytocin, I've also delivered copious amounts of babies that I've delivered. It was like thousands. I don't know, but I've just delivered a lot, and it was always super fun. But oxytocin is the same hormone that makes our uterus contract when we're in labor. Oxytocin is also a hormone that causes out and helps with letdown when we're breastfeeding. But oxytocin is also a hormone that helps me feel peaceful, and it also wants me to kind of connect with people. So I have several patients that'll take it like in the evening, like when they're getting home at work and they're just a little bit more stressed, and so the oxytocin helps bring it down a little bit. And then if you kind of feel like you want to be next to your partner, it makes you feel good because you're like, I don't know why, I just want to be next to you. So it's yet another option that we can try. And the oxytocin we have to get through a compounding pharmacy, just like we have to get the screen cream. So then we march on to other things we can do with the vagina. So I feel like sometimes we feel different down there for some reason. So if someone feels different for some reason, talk about it, ask about it, because we want to feel good. And sometimes people don't even want to think about their vagina. So there's really no right or wrong way to think about it. But if you feel like there is something wrong with you and you don't understand it, and you try to be intimate with someone, you always feel like there's something wrong, and it prevents your ability to just kind of let go and be free. And so review that, get an exam, talk about it, don't be afraid, because there's nothing wrong with having an orgasm. There's nothing wrong with liking sex. There's nothing wrong with feeling connected with your partner. It helps you feel better. And so I just want to hopefully debunk some of those myths and kind of talk about the vagina, help people understand it more. The other thing I'd like to say is the vagina may be one of the most forgiving areas of your body. It has the most amazing lymphatic drainage in your whole body. So it's built, oh my gosh, we have a baby, it splits apart, we bleed, and we urinate and have bowel movements right next door. And it usually never gets infected because it's rockin' awesome lymphatics. So the other thing too is I've sewn up a lot of perineums, a lot of vaginas after babies. I've operated in there, I mean, all about it. But that being said, it's so amazing that you get that tissue just kind of close together and it heals up like a champ. I've lasered my vagina, my face, and my hand at the exact same time. And you know what healed fastest? My vagina. So that being said, it's just another attestment that this area of our body is built to heal. It's built not to get infected. It's self-cleaning. But when we start going through menopause, this is another thing too. So what happens? Okay, with menopause, our hormones leave us. But it doesn't mean we, inside our body, say, peace out, I don't want to use it anymore. No. But we have to understand what estrogen does to the vagina. It increases lubrication and elasticity, or the ability to be flexible. And so it makes it enjoyable, because I've not met one person that enjoys having sex if their vagina feels like sandpaper. That's just not okay. And then so many times they'll go to the pharmacy to get some of the pharmaceuticals, and they charge them like $250 for a tube of cream. That's crazy. So I always like to help them find the most cost-effective way to help have a healthy vagina, with complete acknowledgement that not having a dry vagina can help a girl just feel better. And so anyway, with menopause, the further out from menopause we get, a lot of times these things start happening to us. Well, don't be afraid to talk about it, because we should be able to connect with our significant others without pain and without having to talk ourselves into it. And so I just want to raise awareness for that, because I've just had so many people feel embarrassed to talk about these things, and there is no shame in talking about your girl parts. Your girl parts rock. They help you be yourself. They've been with you your whole life, just the rest of your body, and there is no condemnation with actually any part of the human body. The other thing people get a little bit embarrassed about, I think, in talking about it, but I usually don't get embarrassed really about anything. Not that that's good. I'm like, I'll talk to someone about anything, is stress urinary incontinence. So a lot of these vaginal rejuvenation procedures are built off the knowledge that the vagina is a skin, and skin loves collagen. And so if I can regenerate that collagen, I can regenerate lubrication, health, elasticity. So from my prior life, if you will, as a gynecologist, I thought the only way to the vagina is hormones. But now I realize I can speak to that tissue like a skin, and I can talk to it with radio frequency, I can talk to it with laser, I can talk with it both. And so that's where a lot of these vaginal rejuvenation procedures are. They're different modes of energy that are given to that vaginal tissue that regenerate collagen. And when you regenerate collagen, it's kind of like if you took a blow dryer to saran wrap, it kind of shrinks. It shrinks and it gets a little smaller, and it increases elasticity, and it increases lubrication without the need for hormones. So what a great option for people who, number one, don't want to be on hormones, who can't be on hormones, or just want a better day. Now, the other thing embryologically we have to consider, and so what the heck does embryologically mean? It just means, hey, when I'm developing in my mom's stomach, this is what happened to me. So my bladder, my vagina, and my uterus all originate from the same embryological layer, meaning they all come from a common place. So if my vagina is going through something, my bladder's going through it too. So a lot of times when we go through menopause, we start having more urinary symptoms. Like I lose a little bit more urine, I have to go all the time, and a lot of times people don't like to talk about it. So in working out at the gym too, I find it really interesting that me, as a 45-year-old middle-aged woman, would be like, oh, I better go pee before I start my workout so I don't pee my pants when I jump rope. But how many times when we're younger, we don't even think about that. So if you're training like a middle-aged female or things, when you split our legs apart and ask us to do sit-ups, it can totally elicit incontinence, and it makes people feel uncomfortable. So just be mindful of those things when you're talking with folks. And also don't be afraid to talk about it, because if you are not exercising, if you love to jog and you're not jogging because you're afraid that you're going to be incontinent, there are things you can do about it. There's the surgical procedures that urologists and gynecologists can do, like a TOT or a TVT, the mesh stuff, but some people don't want to do mesh stuff. So do a vaginal rejuvenation procedure, because the vaginal rejuvenation procedures are not to necessarily just make sex more enjoyable, which is great even when they do, but it also helps people with stressed urinary incontinence. It helps you regain your ability to move without worrying about losing urine, and so you just feel reconnected with yourself. So at the end of that, just know, don't feel like as you age, you have to give away all this thing. No, your body's regenerative until the day you die. You just have to speak its language. And the vagina is very forgiving. It really usually prevents infection amazingly well. But the other thing I'll say is if it gets irritated, it will upset your brain. If you have a yeast infection, bacterial vaginosis, group B strep that's really irritating, if your vagina is unhappy, it's hard to smile. So that being said, I just know that it can bring us great joy, but it can also bring us great disdain. So just know your vagina, trust your vagina, know it's part of your body. There's absolutely nothing off limits. Ask questions, know about it, because wanting to have an orgasm and wanting to feel connected to your partner is nothing to feel shameful or bad about. It is awesome and will help you have a great day. And there's absolutely no one that I've ever talked to that feels like their vagina feels like sandpaper, that feels connected. And so don't do that to yourself. Don't feel like you have to sacrifice your well-being for someone else's joy, because at the end of the day, it will make you sad in the end, and it'll make you quit doing that. So the other thing, we were talking about elements in the vagina. So elements in the vagina. So elements are, when you think about the simple seven, it's these 7 things. It's eating, how you move, sweating and detoxifying, sleeping, balancing your energy, having a healthy gastrointestinal system, how you feel about yourself, supplements. So the supplements with the elements with the vagina that I would bring up is I would bring up a couple different ones. Those probiotics, because that will really be something you probably didn't think about. The other thing too is that there's this women's balance thing that we have, and it's every herbal supplement known to man without estrogen that helps people prevent hot flashes and things like that. So there's just lots of different things, different ways to speak to your body, because our body is so cool. So if I was having to mention everything I know about the vagina, those were the pearls that I think I would mention, and just it's part of you. And if you have any questions, don't hesitate to ask. So so Lauren is so great. She prompts me with these questions, and I could talk all day. So the next thing is, why might a sexual drive in a woman decrease? I'm going to remind I always don't remember things. So I'm going to say 3 things. Number 1, if someone has had trauma down there, or they've had a traumatic experience, a lot of times your body can associate that traumatic experience with your vagina. So then if you feel like you're supposed to have an orgasm, you feel bad because you feel like you're living in a traumatic experience, having joy, and it doesn't feel right. Well, really what we have to do is go back with that individual and help them understand or help them work through that your vagina is yours. It's part of you, and nobody can take that from you. But if there's been somebody that's done something to you that's uncomfortable, work through disassociating that and help you reassociate with yourself. So you feel connection with yourself, and when you use that part of your body, you're not feeling connection over here. Because if you live in the middle, it gets very confusing for the brain. The other thing I would say is, when women get really, really stressed, no woman is supposed to have sex, okay? The exception to that, I find, is that people who use physical intimacy as their love language, because when they're super stressed out, every human body wants to regenerate itself. So if we're a woman and our love language is physical touch, then we'll seek out more sex when we get stressed out to try and relieve that stress. But I find that like penetrating intercourse is not the most common love language for women, although if it is, I'm just super excited for that woman. But a lot of ours are more like acts of service or words of affirmation, gifts, acts of service, those types of things. And so when we get stressed, our body doesn't want to give energy away. What is the ultimate energy to give away? The ability to procreate. So when our body gets acutely stressed for a long period of time, the last thing that the human body of a female wants to do is connect with someone else. Because in that connection, you might have sex. So it's in the hardwiring of our biology, actually. And the pathophysiology, which is just like all the blood chemistry that goes on with this happens. It's so cool, but I won't go into it because it just sounds, it could take a long time. We'll do that a different day. But just know that when your body gets acutely stressed and you're there, the last thing you're supposed to want to do is have sex. Now, the other thing I would also say is that after you have a baby, a lot of times the last thing you're supposed to want to do is have sex too, out of the normal biology. Because when you're breastfeeding, if you decided to breastfeed, when you breastfeed, your ovaries are on vacation. Like a lot of time you won't have a period anywhere from 6 to 12 months. Well, that's nature's way of saying, don't procreate so close to this one so your body can heal. It's beautiful. But what happens when your hormones are down, you don't sleep, you're always having a munchkin on your breast, and you're like living for everyone else, you get really tired and sleep deprived. So without testosterone, without sleep, the last thing you want to do is have sex with someone else, which doesn't mean you're changing, which doesn't mean you don't love your significant other, which doesn't mean anything other than you're normal. Now, what happens a lot of times, and I found this when I was breastfeeding the munchkin, my husband is over there, and they want to be part two, but they can't be part of this because they don't have the breast, they don't make the milk, although they can feed with a bottle, right? But so they can feel outside, and then they can feel stressed because they're like, what happened? And then I feel stressed because I don't want to connect with him, but it's not because I don't love him. It's literally because my body's like, don't give any more energy away. If you procreate, you're going to be in a bad place. And I took your hormones away from you too, so you don't do that. But my body didn't do that to me because it's making my life hard. My body does that to me because it loves me, and it's trying to help preserve me in my life. And just know it gets better. Now, the other thing that happens for a sexual drive is as we age and our hormones leave us with menopause, our libido goes down. That is not because your vagina is leaving you. That's not because you're becoming a different person. It's because you lack a hormone that helps you desire sex. It's that easy. So, and it's like so super common, like the majority of people. So again, I'll find some people, again, when they're menopausal, they still have that sexual drive, but their testosterone is nothing. But when I speak to them, a lot of times I'll find that their love language is physical touch. And so they associate sex with some regeneration of themselves. And so those people are the exception to the rule, but I just get maybe 95% more people saying that, yeah, I love my significant other, but I could take or leave sex. It makes complete sense because you're tired, your body is aging, and you lack this hormonal structure to help regenerate your body. So to feel that is normal, there are things you can do about it, and don't feel alone. So I think those would be some of the top reasons that I would say that our libido and our sexual drive could go down. Oh, PAPS, how often? You know what? That's a really great question. So, I come from this era. the whole pap smear screening guidelines have been crazy during my professional career. I think they were super stable before then, and we've changed them like 3 times during my professional career, which is confusing because I used to always associate my well woman exam was a pap smear. If I actually had someone scrape my cervix, then that made me a good person. I checked off the list that as a woman I did my due diligence, and then only if my cervix got scraped did I do the whole thing. Okay? And if I don't do that, then I'm being bad. So actually what they did is they went back and they figured out, or they started asking the question, how many pap smears do I really need to have? And why are we doing all of these? Are we doing too many? Because that it first came out that I was supposed to have a pap when I'm sexually active, then 3 years after I was sexually active, or by the age of 21 or 3 years after I'm sexually active. Well, that's a lot of change. And then they started changing the interval of the paps, like you could do them every year, or every 3 years, or every 5 years with HPV co-testing. And to make it even more confusing, our insurance sometimes, and sometimes does not, cover what the American College of OBGYN, of whom is my governing body, tells me to do to provide the standard of care. How confusing could that be? So this is what I do. First of all, I love to sit down with people, and I love to listen to them, and I love to hear what's important to them. Because I'll find that if people, in the screening recommendations that I should follow would say, I could do your PAP every 3 to 5 years, depending on your history over the age of 30. I'm not supposed to co-test with HPV under the age of 30 because there's like 80% of people under the age of 30 test positive for HPV. It's so common. But what happens is we're all genetically unique. And so I may have a genetic predisposition that if I get exposed to HPV, that it's going to hang with me, while my neighbor doesn't have that at all. So I will have it hang and they'll clear it. I'm only supposed to worry about HPV that persists, because persistent HPV can cause my cervix to get mad, and only if my cervix gets mad am I supposed to care. Now, the other really confusing part with HPV is we still, I don't think, truly understand, if I get HPV, do I have it forever? Or if I get HPV, does it go away? I don't know how to explain that still, and I've been doing this for decades. Because what you'll find is people have negative HPV, but they've had positive HPV in the past, and they get abnormal PAPs when they're pregnant. Well, when you're pregnant, you're immunosuppressed. Some of you isn't you because you're growing a baby, and half of that genetic material isn't you. So if you have a rockin' awesome immune system and half an alien growing inside of you, your body tends to potentially reject it. So it's beautiful what the body does. Maybe that makes our cervix have the HPV come out a little bit more, okay? But they'll have babies and it goes away. So I see that. The other thing you read about is like women who may have like HIV. They have a high preponderance of having really bad cervical PAPs and cervical dysplasia because their immune system is compromised. The same thing that you see if people are on chemotherapy or have cancer. So, and the other thing I would have to say is that when they did all these studies on PAPs, they made this, it's made with a history of people who are they assume after we're 30, we're in a monogamous relationship and we stay there. But both you and I know that is not the case. I mean, so many more people are in like split relationships, or they got divorced and they're out there dating and having sex with different people for the first time for a long time. Well, guess what? You can get reinfected again, and then you get abnormal PAPs again. So a pap smear only looks for cervical dysplasia. It does not look for abnormal uterine bleeding in all cases. It does not look for ovarian cancer. It only looks for cervical dysplasia. So the American College of OBGYN says actually you're supposed to have a pelvic exam every year. But you don't need a pap smear every year depending on your history. But I'll still tell patients that come in, because if I went through all of that history and I feel like if I don't get a pap, I'm a bad person, smoke it, I'm still doing a pap. Because if that woman leaves and feels not completed, she'll feel bad and she'll ruminate about it. And I didn't do her I didn't do right by her. So I still do PAPs every year for some patients because they want that information. And I'm just more into listening to people and listening to what they find concerns with and helping them understand their body in a peaceful way. So I'm sorry that I had to go into that huge long detail, but it's super confusing for you and for us. So I just think that if a woman has a strong feeling about a pap smear, articulate that with your provider. Know that HPV is ubiquitous. I mean, greater than 80% of women under the age of 30 test positive for it. Only if it lingers do we have to do something. So their goal in reducing the amount of pap smears that we did is hopefully to reduce the amount of colposcopies. And knowing that greater than 80% of people test positive for HPV, when you're young, you have a super high chance of making the abnormal cells go away. So if I do all these procedures to these young girls, maybe I affect their fertility. So that was kind of part of their motivation in reducing the amount of PAPs that we do. So anyway, that's what I would say about that. But every year and a half, still go in, talk to your provider. The other thing I would say is I experienced this totally in medical school too. Even when I go to medical school, people get embarrassed talking about the vagina. People get embarrassed talking about the penis. So, but when I was in residency, my reproductive endocrinology staff, he told me, he goes, Sam, if you can't talk about the vagina, your patient can't either. And I was like, you are so right. I'm going to so talk about the vagina. I'm going to get comfortable with my own. And so, that being said, you, like in medical school too, I find that if providers aren't comfortable with the vagina, it's easy for them not to want to do a pelvic exam. But a pelvic exam is important. You know, you can't like feel your uterus, but when you put your fingers inside your vagina and push down on your stomach, you can kind of feel your uterus and your ovaries and see if something big is in there or if something goofy is going on. So that's really the function of a pelvic exam and an annual exam to me. It's just to do it, just do an exam. It's also a time to sit down and take time to talk to that person in front of me, because so frequently as women, we do not take time out for ourselves. And so the annual exam is a time that you can go sit down and just let it all out and see what you can do to help make life a little better. So thank you so much for meeting us today. There's so much more we could talk about, and I hope you tune in next week, and I hope you have a great rest of your week.